and we are very, very much happy that we have here the Chief of the Department of Personalized Medicine of the European Commission, Irene Norstedt, who we would like probably to know more details about the program, what is coming, what we should know exactly to produce our excellence in PPPPM. Thank you, Irene, for coming.
Thank you very much, and thank you for inviting me to come. I understand that you had a very, very nice and interesting day yesterday. Unfortunately, I couldn't be there, but I had some colleagues from the unit participating, so we know what was happening yesterday. So I will go through a little bit about the work that we do. So I'm heading the Personalized Medicine unit in the Health Research Directorate of DG Research and Innovation. So we are one of the components of the European Commission's work in this area. Of course, there are other aspects which are important. Our colleagues from DG Sanko on Health Consumer Protection, our colleagues from DG Connect, and a lot of other colleagues around the Commission who are attached to this field, but we are sort of one of the driving forces to move this area forward. So I will start with a short introduction of what we have done, and first by introducing, of course, what the challenges are. And you were discussing these yesterday. Of course, the enormous loss of value that we have by not being able to treat the non-communicable diseases in the best possible way that we could. We know that there's an increasing pressure on the European healthcare system, and also that in Europe that we're still lagging behind in innovation potential. We have so much fantastic science going on, and we really need to bring that to the benefit of the patients. We also have opportunities, of course, with the stratification and subsequent personalization of healthcare and medicine. And there are some recent studies that are actually proposing that there can be some significant savings by much better tailor the treatment to the right patients. But there are many building blocks that we need to continue to pursue. And the way we see it is we are, through this avalanche of new omics and molecular information following the sequencing of the human genome, we are now coming to a stage where we can go from the clinical definition of disease and to move slowly towards the more molecular definition of disease. In the extension, one can reflect if we also come to a molecular definition of health, but that is also something that is questionable from an ethical and social viewpoint, but we're definitely on this path for time being. And we hope also that with this much better understanding of disease, we can also move from the more treatment-oriented phase to much more on the predictive and the preventive side of healthcare. So what we have done since 2010 in our unit is to have workshops, and also we had a big conference in 2011 in which we have been bringing together all the different stakeholders in this area, because this is not something that science can do alone. It's something that all the actors in the healthcare arena needs to work together. And what was important for us was to bring together all those different stakeholders, the science, industry, patient representatives from the regulatory, and also from the health economic side, to sit together and discuss what are the challenges that need to overcome and how can we actually address those. So some of the stock takings from this exercise has been grouped into 4 different areas. So the first one is about generating the knowledge and developing the right tools. We have a lot of fantastic research tools developed, but we need to see how we actually can adapt those to be used in a clinical setting. We need to work a lot more on the standards. There's so much data being collected, but we need to make sure that we actually can use that data and trust what that data means. So we need to work more on the standards and also on the statistical methodologies by which we are looking at those data. We need to translate the knowledge, of course, into medical applications. One of the key areas where we see the value of that for time being is, of course, the validation of biomarkers, the clinical validation of biomarkers. So a lot more needs to be done in this area. And also to bring those biomarkers into clinical use, not only for new therapies, but also for the existing therapies, and also to bring them also much more into the use in the predictive and preventive arena. We are also need much better clinical trial methodology so that we can go down in numbers in terms of the subjects when we do clinical trials. With novel, more powerful statistical methods is something we could do, and that should also be able to bring down the development cost of new treatments to also feed that pipeline much better and to see more things coming to the market. Something that we have seen is that hugely important is a lot of education and training in this area, because there are a lot of different disciplines that needs to work together that has not a history of really working closely together to bring things out to the patients. And there are different vocabulary used. You may talk about the same thing, but you may use different words, etc. And there is a lot of training and education that needs to come into play now to make sure that we all understand each other and we know what we mean so we can work much more efficiently together. Another very important point is, of course, to understand the economic impacts and aspects. We all know that the national health systems are very much under pressure under cost containment. And what we need is that we need to develop the proof that by stratification and personalized approaches that actually we can create savings in the healthcare system, and by those savings we can actually afford to have much more upfront investments in new technologies and new ideas of how to deal with healthcare. But you know, healthcare systems are very rigid and traditionally set up systems, and therefore we have a lot of work in this area to really come with the proof and new methodologies, new ideas, and show how this could work in practice. So what we have done in our area, as you know that we work through framework programs that run over 7 years, and through the 7th framework program we have started to already address some of those issues I just mentioned. You may know that this is one of the largest multinational funds in the world, and what we do is that we focus on collaborative research. For us, collaboration is one of the buzzwords for us to move forward, and we believe that this is something that fits very well how to work in this area to bring all these different skills necessary together in projects. We also fund, of course, excellent applied health research, and we are moving much more to the innovation side, so we move much more downstream in the coming years to come as well. What we also do is that we bring together actors throughout Europe, but not only throughout Europe, also actually throughout the world, because our program is open for everybody across the world to come together and work in these projects that we are funding. So to give you a flavor of what we have done in FP7, we have invested about 6 billion euros so far in 1,000 projects, which means that we are 11,000 teams working together from 130 countries. Some of the first outcomes, you know that FP7 is still running. We are just concluding the last negotiations, so there are still projects starting, so we don't have the full overview yet of FP7. But so far we have some good outcomes. We already have more than 200 patent applications, more than 9,000 publications, and we already have more than 30 spin-offs created from results that has been coming from the projects that we have been funding. And we hope that this success will continue, and we will of course keep monitoring that, and I hope to come back in 5-6 years time and have tripled or quadrupled that figures. Here are just some examples of the type of research we're funding and also what the endpoints can be. So here is an example with concrete deliverable for patients. This is actually the first ATMP, Advanced Therapy Medicinal product, that has been approved in the EU, that has come from one of the projects that we have funded, and is a treatment for osteoarthritis, in particular in the knee. The second project to present is in rare diseases, which is an area where we do focus a lot of effort as well. Not only because it's an area where we believe that public funding really is necessary due to the low return of investment, and there are so many treatments that are still lacking to address the 6,000 to 8,000 rare diseases that we have. So in this case, it's a project on alpha-monosidiosis, I can't pronounce it properly, which has a very low prevalence, as you see, and there we have successfully funded a project that has completed a phase 2 clinical trial. We also strive to coordinate research at a higher level, and this is a showcase in epigenomics, which is one of the very exciting areas, I believe, where I believe we're going to have a lot of new ideas and new tools how to treat disease in the future. And here we have funded a very large project, which is worth 30 million euros actually, to contribute to an international research consortium on human epigenomics. And we have also from here started to see very concrete results, actually in the area of rare diseases, where results from this project has been brought forward to develop treatments for rare diseases. So these are different examples of how we work that I hope will stimulate you to discuss further today. I know you had a presentation yesterday of IMI, so I don't want to repeat anything, but of course it's one of the big initiatives that we have created in FP7. I believe it's still the world's largest public-private partnership worth 2 billion euros, where we, together with the pharmaceutical industry, are working on developing much better tool for predicting safety and efficacy of new medicines, better knowledge management and education and training. Also here there is a number of very exciting projects and very good results, but I advise you to look at their website for more information. I mentioned epigenomics as an area for international cooperation, but we have actually a whole range of areas, and we see more areas coming up where we actually work at the global level. And how this works when we talk about international cooperation is that we, the European Commission, as a research funders, cooperate with the research funders in, let's say, in the US, so in our case the NIH. We work with Australia, we work with Japan, we work with Korea, we work with Canada. And we come together and we agree on sort of what are the most important research priorities, and then we try to have complementary research funding so we don't duplicate the funding. And then we try to open very much in an open source manner so that the research data which are generated throughout these consortia will be available for research throughout those who participate in these consortia. It's a very interesting and exciting way for us to work, and we believe that this is one of the models that we are also going to continue with throughout the coming 7-year period. So where are we going? And I know that's what you're all very curious about. And as you know, Horizon 2020 is currently under discussion and negotiation between the member states and the European Parliament. And there is a high-level agreement, but we have no formal adoption of this program yet, which means that it is a bit limited what I can tell you because it's still work in process. We cannot launch any call for proposals, we cannot do anything before, of course, we have this decision. So I will give you some sort of general outline of the program and the new approach by which we are going to work in Horizon 2020. What's new for Horizon 2020 is, of course, also that we are welcoming Croatia, which is now a member state of the European Union. So we are now 28 countries that come together. But in fact, it's actually more than 28 countries because we also have what we call associated countries, which are, we can take as example, Norway, Iceland, Switzerland, Israel, Turkey, who all also pay funds into the framework program and therefore also participate on the same sort of rights and obligations as all the European partners. So actually the program is even wider than the 28 countries which are members of the European Union. And as I mentioned, it is open for participation also for other countries. So to put it in a bit of a context, so Horizon 2020 is part of a much bigger strategic plan. And it's the part of the multi-annual financial framework for the European Union. And you may have seen in the media there has been a lot of discussions and negotiation about this budget for the European Union for the coming 7-year period. So Horizon 2020 is part of that program. But there is so much more there which is important for this area. In particular, if you look at the area of smart and inclusive growth, there where you also see the cohesion funds, the structural funds that also can be used to support research and innovation in building sort of regional and national research infrastructure, etc. So that is something that is definitely worthwhile to look at as well. Of course, you also have the education and youth program where you also should look at. So Horizon 2020 is one tool, but there are also many other tools that I would like you to have a look at and see how that can be used. So the research program Horizon 2020 was a proposal for about 80 billion, and for timing we have 70 billion agreed by the member states to go into this to research in the coming 7 years. What's new with Horizon 2020 is that it brings together 3 programs. It's what we call the framework program, plus the competitiveness and innovation program that was managed from our colleagues in DG Enterprise, and also the European Institute of Technology. And the idea is to have a much more streamlined approach and much simpler tools to go forward with. And also what's very important is something I mentioned earlier, is also to couple the research much more to innovation, to make sure that the research investments we do actually go the whole way down to become new tools, methodologies and products that actually come for the benefit of patients and consumers. So you will see a slightly different approach to how we are going to work in Horizon 2020. Another approach is to focus on the societal challenges, and there health has been identified as one of the major societal challenges, so we will be the biggest program in that arena, so to say. Horizon 2020, as I mentioned, it is built on 3 priorities: excellent science, industrial leadership, and societal challenges. And this summarizes, it's very small text there, but you will have these slides afterwards. So health is part of the societal challenges, but there are also other part of this program which is very important for you. So you have the industrial leadership, where you have what's called the key enabling technologies, in which you will have the nanotechnologies, and where you also will have sort of the more basic biotechnology. Whereas in the health, we're going to focus much more towards the clinical applications in this coming program, and the more basic science goes to the key enabling technologies. Of course, you should also look at the European Research Council, which is a fantastic funding machine, but for individual grants, and also the Marie Curie training fellowships. And I will come back to those. So in excellent science part, there you do have the European Research Council, and of course the Marie Curie, and also the research infrastructure, which is a vital part for this area as well. Industrial leadership and the societal challenges. So for the program that we are managing, we will have around 8 billion euro for the coming period. This is something we hear very, very often. It's very bureaucratic. And it is for a reason, and that is because the member states in the European Parliament demands accountability for how the money is spent. You know, we should have as little fraud as possible, and therefore, you know, there needs to be sufficient controls of how the money actually is spent. And you have to reflect on all the papers that sort of you fill out, actually, we need to look at. So simplification is something we all would welcome, I would say, because we want to focus on the science and to bring things out to the market, to the patient, rather than work with people. So there are efforts going into the simplification. So there should be a new balance between the trust and the control. And also, maybe one of the biggest things is that we're moving away from several funding rates for different beneficiaries and activities to just 2, so 100% for research and 70% for close to the market activities. And we're replacing 4 different methods for calculating overheads with 1 flat rate, which is 25%. So I think this is one of the biggest differences for you in the coming program. Also something else, although actually we are not too bad in actually the time to grant from you apply until you actually have the contract if we compare to other research funders across the world, but still there is a high demand that it should be a much faster turnover from your application evaluation until you actually can start the work. So another novelty of this program concerns the SMEs. We have over the last framework program seen an increasing trend towards supporting SMEs, and that will continue. And Of course, SMEs is very, very welcome to participate in our program. There will, of course, be certain areas which will be more SME intensive than other areas, depending on the nature of the research and development that is going on. But what will really be new is that there will be a completely new SME instrument, which is a little bit flavored by the SBIR scheme in the US. And the novelty here is to go with single SMEs. So single SMEs can come and ask for funds in certain areas that will be predefined. This new type of instrument will actually have open calls. It will have cut-off dates throughout the year, and there will be 3 phases where we can go in and fund directly the first 2 phases. The first is a concept and feasibility assessment, where the outcome actually should be a sort of a business plan. And these are very, very fast, small projects, 50,000 euros a lump sum to an SME to work in that area. And then the phase 2 will be much more the demonstration proof of principle, which is, to deliver what you have developed in this business plan. So both those type of phases will be funded throughout Horizon 2020 through open calls and with cut-off dates. So that is a big novelty to how we have worked in FP7. I wanted to say a little bit more about the training actions. So what you know as Marie Curie actions will now be Marie Sklodowska, I don't know if I pronounce it correctly, Curie actions. And the funding levels will be maintained, there will be broader schemes, and the main features are, as before, bottom-up mobility, career development, gender balance, and employment conditions. And here is just a very, very short summary of the different type of actions that will come through the Marie Curie. And I believe that this is something that will be very, very useful to bring personalized medicine forward in Europe. Of course, we should mention the ERC, the European Research Council, which is much more, of course, for the basic, the blue sky type research, but of course very, very important for health is a very, very big component of the ERC grants, and they will also continue to work. So let me move closer to what we do in the health in Horizon 2020. So we have put draft there because we cannot say that this is what it's going to be, even if we believe that we're almost there. And the reason for the draft is, of course, that we do not have the final stamp of approval from the Member States and the European Parliament. We expect that decision to come towards the end of the year. And the main line of this program will be understanding health, well-being, disease, preventing disease, treating, managing disease, active aging, self-management of health, methods and data, and healthcare provision and integrated care. So on the right side, you see a little bit more a breakdown of that, and you do recognize some of those from what I mentioned we also have done in the stock-taking exercise for personalized medicine. So unraveling the complexity of health and disease. So there will be much more the approach towards understanding what are the disease mechanisms, what are comorbidities, etc., and understand that at a more molecular level. Of course, we're going to look at biomarkers. It's one of the biggest areas there where we actually will need to move forward. Of course, there will be a lot of work on advancing active and healthy aging. Of course, we are an aging population. There is a lot more research that needs to be done there and try to keep sort of the aging population active and free from healthcare, so to say, as long as we possibly can. We will also, of course, move closer towards the shall we say, the economic aspects and also towards the more implementation side of healthcare, comparative effectiveness, health technology assessments, etc. Because one of the big shifts from FP7 in Horizon 2020 is that we talk about research and innovation. And of course, for us to go on and invest in research, we need to also foresee and make sure that whatever we invest in actually can come out for the benefit of patients, to be integrated in healthcare or come out as products, etc. So there will be a slightly shift. What will also be a new approach in Horizon 2020 is to move from a rather prescriptive way of the topics that we will publish in our call for proposals. There will be much fewer topics, but much more bottom-up approach. So that is a novelty. It will not be so much disease. We are looking for projects in cancer, or we're looking for projects in this area. It's going to be a much more open approach in view of sort of looking at disease mechanism, etc. That is one of the big novelties. It's going to be much more bottom-up to welcome new ideas, new approaches coming from you. So this is for personalized medicine. I already mentioned some of those. We will continue with the challenges that we have identified. We still believe that those are very relevant. We need to look into some of them, maybe more urgent than others, but we will continue to address these challenges in the years to come. You have also maybe yesterday heard that there is a new proposal for another innovative medicines initiative, which will have broader objectives. So I will not go into the details. I guess it was mentioned yesterday, but I gave you here also the link. The strategic research agenda for IMI2 is out for consultation by FBA, and you have here the link so that you can go in and have a look at it and provide your comments to the research agenda. I've talked about international cooperation, and it is something we believe very strongly in. So we welcome the international community to participate in our collaborative research program. We will continue to work with our international research consortia approach, which means that we will continue to work with research funders across the world to identify major research priorities, and we will go in and co-support those areas. And I think one of the most important part of those is actually also to bring the scientists together across the world and also to share the data to move forward. So that leads me into the open access funds. So open access is something that we already have practiced in the health part of FP7. So it means access to publications, not necessarily access to results. Access to results will always be on a voluntary agreement, because with our grant agreement we have an intellectual property right strategy, so to say, that needs to be adhered to when you signed a contract with us, when you receive a grant. But of course on a voluntary basis you can agree to share the data that you have, and that is something that we practice in the international consortia, such as the epigenomics that I just mentioned. So actually the open access will be mandatory in Horizon 2020, and there will be a pilot for research data. We don't really know much about it for time being, but as I mentioned, we already do practice it in certain areas for international cooperation from our side. So just a little bit about timelines. So, because I guess you're all curious to know what will be in the first calls. Another novelty of Horizon 2020 is that, oh God, I don't know what happened. It's moving. It's a sign that I should close, maybe. Okay, so the work programs will actually be for 2 years. So you will see not only the topics in the first call, you will actually see what will come in the next call. And that will be sort of a rolling scheme, so that you have a bit more time to think and prepare for the calls to come. So we are currently working on the draft work programs for the first 2 years of Horizon 2020, 2014-2015. We are working with the member states on that, and we hope that we can have an agreement with the member states and that we actually could do what we call a pre-publication, which is kind of an information notice in which we describe the areas we will be open. For us this is important because we want the scientific community to see and to be able to prepare in time, because once we publish it will go very fast. We'll have an information day in Brussels, and I think it's 22nd of November. I'm looking at my colleague Anders over there, who is helping to organize that day. So 22nd of November is the day to memorize. That is when we're going to present the new program in detail, and we will also have satellite sessions, so to say, to address different areas where we feel are kind of a bit novel, etc., which are important, where we would like to make sure that applicants understand what we actually are looking for. So memorize that day. The adoption of the work program, formal adoption, can only take place after the Member States European Parliament has adopted the framework program, the rules for participation, etc., which are the legal basis for running the calls. But of course, as soon as that is done, we would like to publish our calls immediately, and we would have the first call deadline in the first quarter already of 2014. We don't know yet exactly when, but we believe probably around March will be the first deadline. And what's important, it will be two-stage procedures. So it will be a pre-proposals, which are a few pages, and those who are passing the needle's eye of that evaluation will be invited to submit two-stage proposals. Here are some contact points for you. We hope that some of those are coming from FP7, but of course we hope that they will continue, and I'm looking at you, our national contact point. So I hope these websites will still be active. Yes, she confirms, very good. So you can use those to find partners, to find more information, and I'm sure as soon as we have more information, we provide them to you and you put them out here, and you are able to also support in member states level the applicants and to do good proposals and to find partners around Europe and across the world, I would say. So something else which is hugely important for us, and that is, of course, we need help to evaluate the proposals as well. And if you have never submitted a proposal, this is actually a very good way to start, is to enroll yourself that you would like to be an evaluator, because by that you also see what is a good proposal and what is not as good proposal. So do please sign up for that. We are constantly looking for new evaluators because we are trying to have a turnover, so we don't have the same people the whole time. And as I said, I think it's also a very good school, so to say, to understand how the system works and also what are good proposals, what do they look like, and that helps you tremendously when you are going to do your application yourself in the future. So with this, I say thank you. I may have drawn over a little. We started a bit late. I apologize for that, but I hope that you have some new food for thought and at least some ideas and for what to come in the coming months.
I thank you very much for this very important information for all of us. And really, we hope we have as soon as possible the complete list. I am sure you have a lot of questions, but try to concentrate all questions in 7 minutes. First question. No question?
Yes.
Oh, yes.
Kofi in Tel Aviv. Thank you very much for the excellent presentation, very informative, and I'm really grateful with a lot of important information. I have a more general question, and you've alluded to the issue of the value chain.
Yes.
So can you tell us more about how you think it? From the beginning?
No.
Can you tell us how you are going to do it? So let's take as an example AIDS.
Yes.
So we can, with personalized medicine, find perhaps what will be the best cocktail for a given patient,
Yes.
which will be very expensive but very helpful.
Yes.
Now, this may be counterbalanced by the fact that people will know that they are safe and will not use preventive methods, will abort condoms, and therefore, and I think that is already happening, that this will be outweighed by the fact that more people will be infected with AIDS.
I mean, that is actually going across to areas which is not really research, I would say, that is social behavior, etc., which we can address to part in our program, but I think when we look at personalized medicine, I think we are much earlier in the stages of proving the value of it. I take what you're saying, but I believe that is much more for the public health program, possibly, than maybe for the research program. But it's something that we could look at. But it's I see that much more as a behavioral issue. I think we are much earlier in the phase to actually prove the value, you know, of biomarkers and see how they can be applied in the healthcare system. You know, how much, you know, can we do savings, or are we just imagining that it's going to be more effective?
But there is also the area of the social.
It is the area of the social, which is embedded in the program, but it's a very complex issue. So.
Yes.
I have a question following that. You know, you're speaking about two major things. First of all, the bottom-up, like the biomarkers and so on. But if we're speaking about personalized medicine, if we're speaking about, you know, the social tail effects and so on, we're speaking, and I'm using another slogan, converting technology to reach personalized medicine. So could you elaborate a little bit more, and you know that I'm stamped with converting technologies, to elaborate a little more how you're going to bridge and to evaluate, because to reach that you need a very interdisciplinary group, including, you know, ethics and regulatory and communities and so on. On the other hand, you're speaking about bottom-up.
Yeah.
So could you say a little bit more about that?
Okay. So when we fund research projects, we welcome very much the interdisciplinarity or multidisciplinarity of the research consortia. And this is how we often tailor the description of the projects. And we do that by saying that we are looking for this impact, that the projects funded under this topic should have this impact. And this is how we tailor. And for you as a sort of consortia should try to have those with you in the project that can make sure that you can reach those impacts. So it's a question, I would say, for both of us. We do it through how we draft the topics, what we're looking for, and for you, it's up to you to find the right partners to make sure that you can secure the path forward. And that you need to describe in the proposal and convince the evaluators that you know what you're doing and that you have the right partners there.
This is the multidisciplinary approach.
Yes.
This is one of the key of the lecture, of the project, always.
Yes.
We need to respond to the special call, but with a multidisciplinary approach.
Yes. And I would say we have moved away from the very sort of research focused. You need to have that kind of visionary ideas of where are you going with your research and how are you going to bring that forward, that you need to describe in your proposals.
May I? Judita Ginkorova from the Czech Republic. I am NCP Health, and I would like to express my thanks to Irene that she very nicely presented Horizon and Health. And from the first program committee meeting, we had the first draft through national comments, and from the Czech scientific community, I must say that everybody is very successful with this. It's done very well, and we are ready to participate. And I'm very happy that she had the opportunity to present it here, because it's right space for collaboration. Thank you.
Thank you.
Thank you very much for your presentation. I am Maria Rosa Fenol from Spain, and I would like to focus on the education field. We have been working here in Europe in introducing the tuning methodologies, so it will be a nice help if when planning the new directives and updating the directives in medicine, that nowadays there is still a confusion on the duration and the competencies, and if it is possible to introduce the concept also into these directives to promote medical faculties to go towards preventive, predictive, personalized medicine. This will be a kind of way to to influence medical schools going into that way?
Sorry to interrupt. Which directive are you talking? Because we have a lot of different legislative pieces. So I'm sorry, I wasn't
So we can go later
yes, we can
on this topic, because nowadays I can see only this in Erasmus Mundus, in a doctorate program, but not from the basic medical education. It will be nice.
It's more education. It's in another direction. Yeah, it's more education. Thank you in any case. One more question?
So I have
Can you give the... Wait.
Yeah, microphone. Take the microphone.
No.
I just have a question about the scaling of projects. Do you have other funding schemes? Do you plan the same like FP7? What are the sizes of proposals? And with up and down limit of funding?
Well, the idea is that in Horizon 2020 it will be very open. With the topics, what we understand, because we are still learning as well, is that we can provide some kind of ideas of what we believe would be the project size that would be suitable, but it does not exclude that you have smaller projects or bigger projects. So that is a novelty. In FP7, we were much more prescriptive, saying that we will not fund projects which are larger than this. And as far as we know so far is that we will not have that in Horizon 2020. It will be up to the applicants to see what are we asking for, and in particular the impact. I want to really emphasize the impact is very important, to make sure there that you have sort of the right skills, the right competences and a good plan, and then do a realistic calculation of the costs for that.
Just Elena, I have a question. But you expect industrial participation, right?
Yes, wherever it's suitable.
And
wherever it's suitable.
And is it expected that industry pays 50%? So, I mean, 50% contribution they have to do by themselves and 50% comes from innovation.
I think you're talking about the Innovative Medicines Initiative scheme, where industry carries their own cost.
It's not in this project. It's not in this program.
So we have different schemes. So you have the Innovative Medicines Initiative, where you have a scheme where industry pays their own costs, and the value of those costs are equal to the costs that goes to the academic participants. And then you have a very industry, public-private sort of collaboration in these projects.
Industry becomes money from the European Commission, but
yes,
has to show that the same amount they invest by themselves. So I experience
the same rules will apply for everybody in this case, irrespective of what type of organization you are.
Okay.
Yeah, it's a simplified scheme.
Thank you.
Yeah.
Last question. Last one.
Very quick question.
Halina Podbielska from Poland. Wrocław University of Technology, Biomedical Engineering Institute. The question is, you said that will be the flat rate 25% for everyone, for SMEs as well.
Yes. Yes.
And the cost, 75% will be paid by the Horizon, and the rest, it will be like now. So that so you pay only the 75%?
No, we pay 100% of total eligible costs.
Okay.
And 25% flat rate for everybody. It's the same for everybody.
Thank you very much. Thank you.
Two questions on behalf of the association.
Yes.
Because we are altogether 44 countries.
Yes.
Here presented 41.
Yeah.
Is it for the new program? Is it mandatory that the coordinator of integrative approaches should be from Europe?
This has been a legal aspect, so I assume that it's going to be the same, because this is more a legal aspect for accountability, is that the coordinator should be from a European member state or an associated country. Okay. And there normally needs to be 3 partners from EU or associated countries, and in addition to that you can include as many partners you find suitable from around the world.
Okay, and to the second question, we have currently 18% of the participants coming from Russia.
Yes.
Next year will be dedicated to the partnership between European Union and Russia. What does it mean concretely in terms of the instruments for this partnership?
This will be based on a bilateral negotiation between Russia and the European Union. There are what we have had in the past has been sort of co-funding schemes that we open our programs with a specific focus on Russia, and that the Russian authorities are paying the Russian participation. I'm not sure we are going to have that type of collaboration in the future, so the exact nature of that, the program will be open for everybody, and then exactly how those bilateral negotiations are going and what the conclusions will be, and that I cannot preempt because I think they are ongoing. But of course, it's something that when we have more information about that, we can inform you. So that,
Okay, thank you very much.
Yes.
This is very important.
No, nothing more? Okay.
Mahmoud,
Just a
the very
quick
last,
question.
yeah.
Would you consider having an advisory group from EPMA in terms of selection of your topics and selection of reviewers and so forth?
The way we work is a very formal way, which is agreed by the member states and the European Parliament. So what we do is that we regularly organize workshops, etc. We go to conferences and talk, and there, of course, we learn information. So we cannot give you a formal advisory role. Because there are many associations in Europe, around the world, who would like to have such a privileged situation. In the area of personalized medicine, there are several different organizations, and we work with everybody. We go to these type of meetings, etc., and we have a lot of open discussions because it's a learning curve for all of us. So I think it's a matter of follow the area, etc., participate in workshops, information days, also work in the member states, work with the NCPs, work with your national representatives in the formal, what we call the program committee, which is sort of the authoritative of the member states who come to our meetings where we discuss what are the topics, etc. So this would be the formalistic way, but we can never give you a formal advisory role.
Absolutely, and sign up for evaluation, for example.
Sign up for evaluation, that's a very...
This is a very good way.
Yes.
I think if we summarize for the time, one, with the states exists the bilateral agreement. The states can participate to the EU program, number one. For the Russia is under consideration. This one is very important to assume the role of the consultant of our expertise, to create really the group of the expert. And number four is all of you is invited to present the candidature as expert. More we are involved in evaluation of the project, more we have the chance to participate and to be recognized. This is something very, very important. Today we represent 40 countries. No one country is excluded by this project. We need only to have the reference of the program, minimum three European countries, but the collaboration is open to everybody. And the more they are, is much better considered by the evaluator. I would like to thank you, Irene. Really, thank you very much for your presentation. And I am sure we keep this information in our website. We are ready to give you all information at any time, and one of the roles of the association is the consultant's role. If you have the doubt, send us the message, write us, send us the proposal, and we try to evaluate. Tomorrow is really a very long day for the project. Thank you very much, Linda. Thank you very much.
Thank you.